Well, good afternoon, everyone. We want to welcome you to the Flint the Flint Community Webinar Coronavirus. This is week 71, July 23rd, and on behalf of the Healthy Flint Research Coordinating Center, we'd like to welcome you. We're also sponsored here today by the Flint Center for Health Equity Solutions and the Michigan Prevention Research Center. This community and academic partnership with the Healthy Flint Research Coordinating Center is hoping that this information today will be helpful to you. It's designed to help us to identify what resources and services are available in our community during the pandemic, as well as other ongoing issues that we have in our community. I'm excited today to be your moderator. My name is Yvonne Lewis, and I am a co-director of the Healthy Flint Research Coordinating Center. As I mentioned to you earlier, it is 71 weeks of this partnership, and we're excited to be able to every week display this wonderful banner that shows the many community partners that have joined us to help provide information to you. So for those of you that have joined us by phone, we'd like you to know that there are an array of community partners from the Greater Flint Health Coalition, Genesee County Health Department, Hurley Medical Center, McLaren Flint, Hamilton Community Health Network, even from the state of Michigan, Genesee Health Plan, Michigan Department of Health and Human Services. And I'm naming these today because I want you to know that while we're in the webinar, representatives from these organizations like Genesee Health Systems are here to answer questions for you. So please feel free to put questions in the Q&A as we're going through the webinar today. If you are not able to join us in the webinar live, you can also call us at 810-835-2130, 810-835-2130, and put those put those questions there, and someone will be happy to make sure that we get those questions from you. We have an exciting webinar for you today. We're going to be talking about COVID booster shots and what we need to know. We'll have an update from the governor's office. We'll also continue to provide updates from the Genesee County on the status of COVID in our community. We'll have a little information to you from the City of Flint Water Infrastructure from our department, Director of Department Public Works for the City of Flint. And then our policy brief will give us some information on policing disparities that are confirmed in the state of Michigan. So we are excited that you joined us today, and we want you to sit back a little bit. Today, we're going to start our webinar with a little bit of a meditation, a little bit of a mindfulness moment with Katie Baxter from Genesee Health Systems. We always give you so much information. Today, we wanted to start off with you just taking a pause and being led through this exercise by Katie Baxter. Welcome, Katie.
Thank you so much, Yvonne, for having me. And thank you for thinking about mental health and reminding us how important it is to take care of our mental health. I want to do a couple things. One thing I want to do is normalize some of the feelings that we're all going through. It's so important. This has been a difficult 16 months, and many of us have had so many challenges. We all have the pandemic in common, but we've experienced it differently. Some of us have had a lot of inconveniences and frustrations and concerns and trying to balance educating our children at home and work changes and all of these kinds of things. And some of us have had job losses and other economic problems. And tragically, some of us have had losses in our life. It's been a very, very difficult 16 months, and put all that together on top of the racial injustice that we've experienced. And it's very difficult for all of us during this time. And I want to normalize that these are normal feelings. If we're not feeling just right and have worries and anxieties, those are normal feelings when you're dealing with stress and trauma. And that is a normal reaction to that. So I want to let us know that. And also, I want to go through a brief exercise to allow us to develop some resiliency. All of us go through challenges in our life, and that's not going to change. that will continue as long as we're human. And it's really important to take care of our mental health and to learn some simple things we can do to take care of ourselves and feel more resilient. And resiliency doesn't mean that the trauma didn't happen to us, but it means that we can take care of ourselves and we can still be okay. So I'm going to invite you to join me in an exercise, and I'm going to invite you to turn off your cameras. And the reason I invite you to do that is so you do not feel distracted if you want to close your eyes during the exercise and participate, and there won't be a distraction of feeling maybe you're being watched. So I'm going to invite you all to turn off your cameras and to join me in this exercise. So I'm going to ask you and invite you to sit comfortably in your chair with both of your feet touching the ground and your back against the backrest and your arms in a comfortable position on the armrest or by your side. I now invite you to close your eyes if you are comfortable and to focus on your breathing. Breathe in slowly for the count of 3 and then out slowly. Bring your mind's focus to your body. How does your body feel sitting in the chair? Notice the back of the seat, so the whole length of your back is pressing into the back of the chair. Can you feel the contact between your body and the chair surface? Is it warm or cool? Soft or firm? If the chair has arms, notice, is the material smooth or textured? Allow your arms to press down the length of the chair arm and notice how your hands hang off the end. If your chair doesn't have arms, touch the material on the seat and notice how that feels. Next, focus your feet on the ground. Focus on your feet. Imagine the energy draining down from your mind, down through your body, and out through your feet into the ground. As all the energy drains down from your head, feel how heavy each body part becomes. Your torso feels heavy, and now your arms as you relax those muscles. Feel the heaviness go down through your legs, down through your feet, and down into the ground. Allow all the tension to leave your body through your feet. Focus on your breathing, relaxed and calm. You are in the present moment and you are safe. Your breathing is relaxed and calm. Now, when you are ready, open your eyes. And if you would like, you can turn back on your video now. Thank you so much for participating in that little exercise. I hope you enjoyed it. It's just a couple minutes, but it's one thing to think about that these are simple things that we can do. And we can do this on a regular basis. And this is important because our nervous system remembers everything that happens to us, all of that trauma and all that stress. And this is a way to engage our parasympathetic nervous system. Our sympathetic nervous system is what reacts when we're under stress. But when we engage our parasympathetic nervous system, we can come to kind of a homeostasis and a calm. And it's a good place to be, and it's when we do our best thinking, our best decision making. So thank you so much for that. And please remember to take care of your mental health. And if you need to ask for help, that's okay too. And I'll make sure information, our contact information from Genesee Health System is in the chat, so you can reach out and contact us if you need to. Thank you so much.
Thank you so much, Katie. We appreciate that. Now, all of us are really, really relaxed. And this is a good thing. Maybe in the middle of our day, when we've got that 5 minutes between meetings, we can use this exercise to help us prepare for the next meeting. So again, thank you, Katie. It helps us to get ready for all the great information. We're going to hear from Gary Jones. Gary is a representative from the state of Michigan out of the governor's office, community affairs rep for Flint. Gary, give us the update for this week.
Yes, thank you, Yvonne. And my apologies in advance. I am off camera today. I'm actually out here at the ADA Day over here at Powers High School, just leaving the event that the Disability Network put together. So great event, very heartwarming just seeing so many people out and just enjoying this day. It's not too hot, not too cold. So like a perfect day for this event. A couple of brief updates here. So a Grand Blanc resident has won $1 million in Michigan's COVID-19 My Shot to Win sweepstakes. The $1 million winner got vaccinated in late March in Flint. She got vaccinated to protect her family, is what she mentioned last week. The very first winners in the My Shot to Win sweepstakes for vaccinated Michiganders were announced. 4 randomly selected individuals who received their first dose of the COVID-19 vaccine, each won $50,000. As of Friday, July 21st, more than 5 million Michiganders aged 16 and up have received their first dose of the vaccine. So just as a reminder, the sweepstakes run through August 1st, 2021. Also, Michigan residents who want to vote in their local election next month and have not yet registered can still do so in person at their clerk's offices up to 8 p.m. on election day, August 3rd. If you need the location of your clerk's office or local drop boxes or other voter information, visit michigan.gov/vote. That's michigan.gov/vote, V-O-T-E. Governor Whitmer recently signed a bill which allows workers temporarily laid off due to a manufacturing shutdown to continue to receive unemployment benefits without looking for a job. Under the current law, workers laid off for more than 45 days ago were required to search for work. This bill recognizes that in the manufacturing setting, certain events triggering a temporary layoff, like a part shortage, can last more than 45 days. Also, to all Michigan families who are eligible for food assistance benefits are receiving an additional monthly payment in July in response to the COVID-19 pandemic. More than 1 million people and close to 700,000 Michigan households will benefit under approval from the U.S. Department of Agriculture, Food and Nutrition Services. And with that, I'd like to close by promoting the michigan.gov/COVID vaccine website, as well as the michigan.gov/coronavirus website. Still the best catch-alls to keep updated with all things COVID or vaccine related.
Thank you so much, Gary. I know people were just chomping at the bit to find out how that My Shot to Win program was going, and now we know that it is legit and people are receiving, they're being selected, being picked out and receiving those resources. So thank you for sharing that with us today. I also want to emphasize this is an election period, and so as Gary has mentioned, your voice counts. So let's please get out and make sure you are counted in the vote. I want to go to our roundtable today. There have been a lot of questions about COVID. Last week in our roundtable, there was discussion about COVID had not made its way to Genesee County. So I'm going to ask our panelists, Dr. Reynolds, Dr. Wilford, let's see, Dr. Hackert, please come forward and let's talk a little bit about where we are with our Delta variant in Genesee County, as well as this whole conversation about boosters. We're going to have a little presentation a little bit from Dr. Wilford, but just want to have a little bit of a discussion about it. So Dr. Hackert, can you give us an update on the Delta variant for our community?
So I don't recall what day we had heard, but we do have 2 cases now identified in our county. Undoubtedly, there's quite a few more. The Delta variant is over 80% of the new cases identified in the United States now. Michigan's a little bit behind that, I think, but still catching up. Probably more than at least half of the new cases are now Delta variant. One of the things that we are finding with the, how we had the need to send out samples to different labs around the country is that these private labs may take a little bit longer to get back whether or not it's a variant case. And so that's why it sounds kind of like, iffy, but that is about where we expect it to be. And the Delta variant we know is more transmissible than the original and even more transmissible than the Alpha variant that first arose in the UK. It's also thought to cause more severe illness and more hospitalizations. We are seeing a slight increase, and it's a slight increase, but the trend is there, and that's what's really critical to talk about, is that it looks like with the trend going up the way it is, it looks like we're at the beginning of another wave starting. And if you were able to go back and look at what those beginning weeks or week or 2 of the previous waves look like, it did look like this.
So the other thing that came up, and hopefully you can give us some insights, when they talk about breakthrough cases, what does that actually mean?
So a breakthrough case is someone who has been fully vaccinated and at least 2 weeks after the last dose. So if you've just had the 1 shot, it's 2 weeks after the Johnson & Johnson. If it's the mRNA, it's 2 weeks after your 2nd shot. If you had a previous case, or if you are fully vaccinated, to get another case of COVID after that time period, that's called a breakthrough in vaccines. We know that that was something expected, but at the beginning, even with our 97% effective. However, now with the variants of concern, particularly the Delta variant, it's estimated that maybe between 35% and 12% of people who are vaccinated may be susceptible to getting a case of COVID after vaccine.
Okay. So one of the things that this is important, Dr. Hackert, is that now we're getting ready to go back to school, and I know we may not be able to talk fully about what's going to happen with the masking, but I want to hear your comment about it from broadly from your perspective, and then I'd like to hear some comments from our 2 pediatricians with respect to what this means for our children.
So I think it kind of surprised everyone earlier, ages ago, a month ago, when the CDC was saying a little bit more like we can just go without masks completely. Even though the Delta variant, that one that's most concerned, has been around since December of 2020. And so we knew that it was coming because these things, the world is a small place when you have transportation, and transportation among countries is opening up. So we really could have expected it, we just didn't know how much it would affect us. And that was determined by the percentage of people who were vaccinated. Because if you're vaccinated, you're going to have fewer spreading cases. Even if it's very transmissible, it's still going to be fewer cases. So unfortunately, we did not meet our goal of 70% vaccine rates, and we are seeing those cases going up again. And I'm sorry, tell me what your question was again.
No, we were talking about masking for children.
Oh, masking for children. Yeah. So they had come out with that recommendation that you didn't need masks, and they had still said all along, they recommended unvaccinated people wear masks. And of course, children 12 and below don't have a vaccine available to them. So they were recommending still that children be wearing masks, but our cases were very low in the county and the state. That really changed as we started to see these numbers creeping up again, looking like a fourth wave. And then the AAP, the American Academy of Pediatricians, they came out with much stronger language now, just this week, I think on Monday, and suggesting that all children and staff should be wearing masks in school, regardless of vaccine status. And I thought it was pretty interesting when you actually look at it. So if you wanted to see what that looks like, you can just Google, actually put this in here too. I'll put it in the chat. To everyone. So this will give you a link right to the guidance from the AAP. And I think it's very interesting that, I don't want to go through all the bullet points right now, but it's also like things like potential difficulty in monitoring or enforcing mask policies for those who are not vaccinated, if you're trying to make a distinction between vaccinated and unvaccinated for the older children. Also, it helps prevent transmission of other diseases, influenza, colds, which are going to confuse the picture again, just like that was all talked about last fall.
Exactly.
Sad we're doing another year. And also about the vaccination uptake in the surrounding community. Then if you keep going down the page, you'll see that it said school COVID policy should be practical, feasible, appropriate for the child and adolescent's developmental stage, and address teacher and staff safety.
Yeah.
So if you break that down, it's like, the younger children, they need to see facial expressions more for learning literacy. Those are the kind of things they're trying to address with this. And, it says special considerations to account for diversity of use should be made, especially for populations facing inequities, medically fragile or complex, anyone with disability, and that also that these policies should be guided by what's happening in the community right then. Right. So that gives us a big task, though.
Yeah, so it's a big thing. And so I want to encourage too our community health workers and our social workers to look at that document in the chat that can help give them some ways to respond to questions that they might get. And so we can hear quickly from our pediatricians as they're thinking about this. Anyway, we have one that works actually in the hospital with families, and then Dr. Reynolds, retired pediatrician, but he also gives us good insights for the city. So Dr. Wilford.
Well, thank you so much, Yvonne. I can be very quick on this because I really think that safety is the best policy. And because of all the different things that one has to take into account in order to keep children safe, it is just the best idea to keep them wearing masks where possible. And I know I see a lot of kids in clinic who in the beginning, it was a challenge to get them to put the mask on, but they're much more used to it now. And we have lion designs and different cartoon designs, and everybody's happy with the different designs on their mask. There are ways to make it work. And I think we should definitely try to do that. It will also help prevent more of these variants being developed. The Delta is the current one we're concerned about. It will not be the last one. But the more we allow the virus to circulate in our community, the more we allow it to mutate, the more dangerous we allow it to get. So I think masks are the way to go. I agree with the AAP wholeheartedly.
So I see you nodding, Dr. Reynolds. Thank you, Dr. Wilford. Dr. Reynolds, you're gonna have to repeat that because you're on mute right now. There you
I'm
go.
very thankful for my public health colleagues and my pediatric colleagues, family practice, and all the other colleagues who help, and our nursing colleagues who help us make wise decisions, because this is a team effort. And I'm sure we all agree on this one thing: prevention is the best treatment, and vaccination is prevention. So that is the foundation of everything that we're trying to do. And then we have layers of protection. And in this rapidly changing situation, if we want to reduce our risk of problems, we apply these layers. The next is mask. The next is physical distancing. The next is washing your hands. And as adults, we have the responsibility to model proper behavior for our children. And I guess that includes people under 30. But you know, they watch us, and what's the first thing a 14-year-old will say to you if you're not doing, or they saw you not doing what you recommend? Well, you don't do it, or I've seen you do it this way. And so we have to think like adults and act like adults and model that desired behavior. Put on the mask when you're in school, when you're in a store, when you're in service, when you're at a party, when you're at a funeral. And those are the things that we must address. It's basic. After we get vaccinated, do those things to protect those who are not yet vaccinated.
Thank you, Dr. Reynolds, and for Dr. Hacker, Dr. Wilford, and Dr. Reynolds. Thank you so much for those insights. I know we're going to hear a little bit more from each of you in the coming minutes in this, so you may want to add a little bit as we go forward. But thank you for sharing with us in this roundtable. It's more information that helps us to make those informed decisions. So we want everybody to just keep thinking, ask those questions. And as we often say, things are changing every minute, every day, every couple of days. So we're giving you the best information that we have now so that you can make decisions that will be helpful for you and your families. Thank you so much. We're going to go to Dr. Wilford. I'm going to ask you to stay on with us, Dr. Wilford, because you mentioned, we talked a little bit about boosters, and Dr. Hacker, we talked about other childhood immunizations that we all know about getting boosters for, but a little bit different with where we are with the COVID vaccine. So Dr. Wilford is going to give us some helpful tips about the boosters today.
Thank you so much, Yvonne. So I want to share again about boosters. We talked a little bit about it last week, but I wanted to add some more about it today. And so I was trying to think about the two major reasons why anybody even thinks about boosters. Why is it that this is even a discussion? And it's a discussion because we have to think about the fact that we have changes in our body and over time, and we have changes in the virus over time. And those are the two reasons why boosters are even a discussion. And so if we look back at some of the other conditions for which we give vaccines, let's start with measles, for example. If we look at this graph, we see we have immunity measured on the side and time along the bottom. So as we go across this graph, we're thinking about changes over time. And if the immunity gets up into that green range, we'll say that that's good immunity. So when we give a vaccine for measles, that gives us that immunity that tends to last for decades. And so if you are immunized as a child, you likely do not need to get immunized again as an adult for measles because it has such long-lasting immunity. If we think, on the other hand, about flu, it's a little bit different, as you know. So we get some immunity. It isn't actually as good as the measles immunity, but it's good enough. It's great. It's 40 to 60%, and it's better than not having it, certainly. And it also prevents against more severe illness. But that wanes over time. You see, the immunity goes down and dips below that good immunity range. And so that's why one would need a booster for the flu shot. So why some immunity stays high or gets high, and how long that duration or that length of immunity lasts varies, and it depends on a number of factors. So first of all, as we've just pointed out, it depends a lot on the different disease we're talking about. So which virus are we talking about? That impacts how good the immunity is, we'll get to it, and how long that immunity will last. The type of vaccine we use also makes a difference. So are we using an mRNA vaccine? Those are the Pfizer, the Moderna. Is it some other kind of vaccine? And there are many, many kinds of vaccines out there. That will have an impact on how good that immunity is and how long it lasts. The age of the person who's getting the vaccine matters. So those of us over a certain age may not have as good a response as others who are younger. And so our immunity may not get as high and may not last as long, depending on the age of the person getting the vaccine. And then, of course, the health of the person getting the vaccine. So if you have some illness that makes your immune system not work as well, or if you're taking medication that impacts your immune system, that will also impact how good the immunity is and how long it lasts. So let's think about COVID specifically, because that's what we're, I suppose, most interested in today. So we give one vaccine. Let us think about the mRNA vaccines, right? We give one shot, and with that one shot, it gets us up to an immunity of about 85%. And then at about 4 weeks. So 3 to 4 weeks, we give another shot, and that gets our immunity up to about 95%. And we're like, whoa, strong work. This is fabulous. And then what happens after that is a question. And the problem is one has to study this long enough to know what happens after 6 months, 8 months, 5 years. And we have those data with other diseases, but with coronavirus, we just haven't had it around long enough to have data out several years. But what reassures me as somebody who got her vaccine in January is that we have data on people who were in the studies. So they were in the studies months ahead of me. And so we can see what's happening with them. And so we'll know when their immunity is waning, if it's waning or if it's staying up. And that will give the public health experts enough time to give me advice about when, if and when I need to get another shot. And so we'll see that from the data as they follow those people who were in the studies early on. Unfortunately, it was a whole lot of people, which is really good news for us. So we ask ourselves, well, what was in that second shot? It's important to note that it was pretty much exactly the same thing that was in the first shot. And when we think about whether or not we need another one, if it goes out normal, like the measles one, and lasts for a very long time, or if it dips more like flu and we don't have the immunity for very long, then we'll, if it does that dip, and we see that in the data from the people who've had the studies, if we see that from those data, then a third shot would be recommended. And the question is, well, what could be in that third shot? In many cases, it could be the same thing that was in the first 2 shots, exactly the same thing. Or sometimes they even think about giving half of the amount, and that's enough to boost it back up. So the question came out this week, well, why not just wait for the third shot? I want to give an example. And examples sometimes are risky because they're not exactly the same in every possible way. But I'm going to give, as we're talking about shots of vaccines, I'm going to give an example of shots of drink. Now, I have to say that I don't drink alcohol, never have, so I may be off on this example. But if you take a shot, and this is water, but I live in a university town, so I know that the shots look like this. So if you take a shot and you drink one drink, okay, so you feel like you've had a drink. And then if you take another drink, it raises your level more. Now, if you take a third one, that will raise your levels of alcohol in your body even more. But if you skip the first 2 drinks and just take the third one, well, that's just your first drink, right? It isn't boosting anything. It is just your first one. It's like if you have a plate of food and you're kind of sort of okay full, then you have another plate of food, then you feel really full. And you have a third plate of food, whoa. If you just skip the first 2 and you just have the third one, it's just your first shot because it was exactly like the other 2 shots. Now, so I think we have that illustrated here on this slide, which I hope I'm still sharing, that there is the first shot. It's just like if you skip all the other 2 and you just take, when they start giving boosters, you take a shot then, it is just like your first one because you didn't get the first 1 or 2. Now, I just want to point out here very quickly that the second thing that matters is the virus, how that is changing over time. And so while we're giving all those shots at the same time, the virus is changing. and it's changing. If it changes in small ways, then our immunity is not impacted, all is well. But if it changes instead in a big way, makes a big change, then the vaccines may not work as well. Our immunity to that new virus, new variant may not be as good. And so then in that third shot, rather than just giving us the same thing they gave before, they may tweak the ingredients to be able to help us deal with the new variant. So hopefully that gives you some ideas, a greater understanding of how boosters work. And we're happy to take any questions about it, and we can address it again moving forward in the future.
Just really quickly, thank you, Dr. Wilford, but we did have one. Speaking of boosters, I heard earlier this week or last week that J&J shot does not provide the protection we need. Can you speak to that?
So I think that the studies are being done on that right now. And J&J suggests that theirs is doing fine against the variants out there, but I believe that they are doing studies at the moment to see if, like everybody is, Pfizer's doing it to see if they need to change theirs in any way or offer more shots, and so is J&J. So I think we have to wait for more data with more people to be able to answer that question.
And that gets us to the point that we've been making over these last few months. We're all in this huge experiment. We've never seen this before. And as you mentioned, it takes time to see just how well these things are going to react and how we're going to react or respond to them. So thank you, Dr. Wilford. Very challenging to help us figure this out, but we appreciate your example for helping us see what the impact of boosters are. And if we don't get the first and second dose, the booster really isn't boosting anything.
It really isn't. And oh, don't leave this saying that Dr. Wilford said drink alcohol. She was not. It was just an example. So think of them eating a meal one instead, maybe. But yes, we need to boost it.
Yes, thank you for clarifying that, Dr. Wilford. Appreciate it so much. Dr. Hacker, we need you to come back. There's some additional information we want to get from the health department perspective, and you have a very important illustration to show us as well today.
Yes, and I do believe that the ACIP guidelines on regarding Johnson & Johnson did just come out this morning. They were talking about it, saying that, so let me see if I can find that for you here. You know, it is the CDC level, so it's a little bit, you know, complicated, but I think there's still, particularly on slide 10, it's pretty useful to look at that. So I would say here's slide 10. And basically, though, with regard to the third booster dose, they have deferred to the FDA for that now. So the ACIP has said that there's some good reasons to get the booster dose, just as Dr. Wilford was saying so well, and that, however, they would be deferring to the FDA for all three of the types of vaccines we have available here as to whether or not booster doses are needed. So yes, this is one thing, like coming back down from the national and world level. This is Genesee County. And I just wanted to kind of have some numbers, and I know Sherelle usually shares numbers, but I wasn't sure if she was going to show this trend though. And so if you see here, these are just like the last week or so, 9 days. This is as up to date as we had gotten this exact numbers. But here is the number of cases or number of tests that we're doing in the county right now. So vastly lower than it was a year ago, but we have other tools at our disposal now as well. And cases are still low. But basically, it's not been changing too much from day to day. This day we had a little boost in testing. But for the most part, it's been between 300 and 350 tests per day. But our positivity here 10 days ago was 0.0 or 0.3. So less than 1% of these tests were positive. But now it's been climbing every day. And it is now up around 5% of our tests. Same test number done, but now it's 5%. And I think this is really showing that the Delta variant has a grip now in Genesee County. And we would probably expect that to continue up And really it's vaccines, getting the vaccine, social distancing, wearing masks, all those things can help stop the spread of this, but it is easier to transmit, particularly among unvaccinated individuals. And here you can see as well the numbers creeping up by the week.
Thank you so much, Dr. Hackett. And I do hope that particularly those of you that are helping us get the word out, just continue to encourage our residents to get tested, because that's how we understand what's going on. And now Sherelle will tell us where we can go to get the vaccines and to get tested. Thank you, Dr. Hackett. Sherelle.
Good afternoon, everyone. I always want to say good morning. So yes, like Dr. Hackett said, our positivity rate is continuing to increase. And I just want to say that we all have to be mindful and continue the practices that we were practicing to bring our numbers down where they once were before, which includes social distancing, wearing that mask when out in public, and of course, getting your vaccinations. In Genesee County, we have administered over 320,000 vaccinations. The numbers on the screens aren't up to date for this week, so there's more. And we want it to continue being more. So get your vaccination. A lot of people says, well, you can get COVID again if you've been vaccinated already. That's true, but you have a very high percentage rate of not having a breakthrough infection if you get your vaccine. So again, we're encouraging you, if you haven't had it, to come out, get your vaccine. Next slide. And places where you can go in the upcoming week. We'll have 2 short clinics on Monday at Briarwood Apartments and Lockwood Apartments in Davison. That first clinic will start at 10. It'll go to 11:30, and then we'll have a later one from 2 to 3. So if you're in the Davison area, you don't have to be a resident of those apartment complexes, but you can visit those clinics. Tuesday will be at Our Lady of Guadalupe from 10 to 2. Wednesday, Central Church of the Nazarene from 9 a.m. to 12 p.m. At both clinics, you can receive Pfizer, so make sure if you have kids who are 12 and older that you bring them to the clinic to be vaccinated. And Thursday will be at Shiloh from 1 to 6:30. And everyone who came out to McDonald's on Miller Road when we had our 3-day event, it is time for your second dose. So we ask you to come this Friday on this Friday, next Friday, on July 30th between 10 and 2 to get your second dose. And if you still need a dose, we'll have Johnson & Johnson, so you can come get your first dose at that clinic. And then Friday, Fleming Road's Block Club is having a block party. Saturday, July 31st, and it'll be located, our setup will be located at 2117 Kenneth Street, where you can come and be vaccinated from 1 to 3 p.m. We'll have Pfizer and Johnson & Johnson available. So if you're in the neighborhood, live in the neighborhood, and you need a vaccine, come to the Block Club party. You'll get your vaccine. And we also want to remind you to continue going out and getting your test. If you know you've been in contact with someone who is positive with COVID, as we know, we do have the Delta variant in our county. So we want to make sure that we're testing. And on the screen, there are a few locations where you can go to be tested for your COVID-19 at Rite Aid or Walgreens. Locally, we also have testing at the Hamilton Community Health Network and Genesee County Health Center, as well as Word of Life Church, Bethel United Methodist, and at Macedonia Baptist Church. And again, no more pre-registration. All clinics are walk-in. We keep our schedule listed on our website at gchd.us. And we also update you here on the webinar. So you can walk into any clinic that's available to you and receive your vaccine, and you have a choice. If you know anyone who is homebound and cannot get out to the clinics, we are still serving them. So we ask that you give us a call at 810-344-4800 or visit our page and click the link so that we can get them on schedule to receive their vaccination at home.
Thank you so much, Sherelle, for all that information. So there's plenty of opportunities, and I know for a fact there are going to be more opportunities coming up in the very near future for our community residents. And so we're going to ask now for more information the COVID situation in our community. Mary Catherine, who prepares a policy brief for the Flint Center for Health Equity Solutions every week, will give us an update on the policy brief. Mary Catherine.
Thanks, Yvonne. So it's really great to be here with everyone as always. So if you have any questions about the legislation discussed in the brief, please just shoot me an email at crawf457@msu.edu. If you have any questions about the data that's been presented or will be presented, please contact my fabulous colleague, Rick Sadler, SADLERR@msu.edu. So recall that, well, we already have talked about this, but last week, Dr. Verholden had told us to assume and operate as if the Delta variant was here in Genesee County. And as you've heard from our panelists, we know that it's here. So it's really essential to keep an eye out on these numbers, as Delta, of course, as we know, is much more transmissible, and cases are increasing, and our vaccines rates did remain stagnant this week. So after 10 weeks of consecutive decline, right, we are seeing cases slowly creep back up. And if you take a look at the last 3 weeks in Genesee County, we saw an increase, and then again this week in Flint. Even though this week the increase totaled to be about 6 cases, which may not seem like a lot. Of course, we encourage you to take a look at the trends that are linked in the health equity brief to really visualize what Dr. Hacker had mentioned. And with that being said, I'm just going to echo what Dr. Reynolds had mentioned, that we need to be vigilant, and that prevention is our best strategy to keep everyone safe and healthy. So I will go ahead and kick off into recommendations. So there is some recent legislation in the Senate that seeks to limit the functionality of the Department of Health and Human Services, in addition to our local and state health departments. And this is relative to their ability to use emergency public health orders, including mandatory vaccine programs. And I just want to point out, for more information, of course, you can take a look at the brief, but when we're talking about any legislation or bill that limits the function and authority of health experts to preserve public health, we're actually undermining our own health and putting ourselves at risk. Our legislators are putting us at risk for additional outbreaks and new COVID variants. And the second piece of legislation I'm going to talk about precedes a report from the Michigan State Police that does confirm disparities in policing when it comes to Black motorists. So what this legislation does is set new minimum and improved standards for police training in several areas. And so we expect that this will then improve policing standards and reduce the disparities that we're seeing. And that's because when we use best practices and address implicit biases, we limit the hazards that this population faces relative to the issues of over-policing in Black communities. And we have to bring up the breaking news that Mayor Neely has declared a state of emergency in response to rising gun violence in Flint. So as a result, his administration will be using an emergency response team comprised of law enforcement officials and community partner organizations. So this is really important legislation that, if passed, could certainly bring some positive impacts to the work Mayor Neely is doing in the Flint community. So for more, just sign up for the Health Equity Brief or check it out on our website.
Thank you, Mary Catherine. So we know there's more to come to help us really understand how valuable our voices are in these situations. So thank you, Mary Catherine. Flint Voices, we heard you. Many questions have come up over the weeks about what's happening. And we have a new Department of Public Works Director, Michael Brown, who is here with us for the first time. Michael, welcome. And we look forward to you sharing some insights with us today.
Well, thank you very much. One of the first things, if in your chat, if you take a look, a little bit ago, I put in information Today is the last day for Get Out the Lead, or Get the Lead Out, for City of Flint service line replacements. And if you haven't signed up, there's over 2,500 people in the city that haven't done so yet. If you don't do it today, it won't be free after today. So I'm trying to make sure that those numbers are out there so we can get that information. And Heather just put it out again for me. I thank you. Heather Lund, I'm sorry. The second thing is, this is a COVID, and I do have one thing of COVID information that I can share. That is that the wastewater treatment plant has been sending samples out to a company that has been checking for COVID viruses. Starting very soon, U of M Ann Arbor will also be taking samples from the wastewater treatment plant to monitor the health of the city through the wastewater treatment plant. And as of back in July 10th, was the last time I had an update, and the last 2 weeks of sampling had shown no viruses detectable in our wastewater stream for that company. So as I get that information, I will make sure that either I or someone else from the city of Flint that comes on to this forum will be able to give that information out. And that's about all I have right now, trying to be short and sweet because we are running out of time and I do want people to be able to ask questions. So I will turn it back over to our moderator.
Okay, so thank you, Michael. Put your questions in the chat. Michael, while you're still here, I do want people to know that you are a Flint resident. You were a Flint resident years ago. And so you have a real passion for what's going on in the city. Maybe you could give them a little bit more about that.
Okay, yes, I am a City of Flint resident. In fact, I was born here in Flint. I'm not going to tell you the years. I've been here for a while. I only left the Flint for a couple of years to go to high school. Other than that, I've been either working in Flint or going to school. I graduated from the University of Michigan. I used to live over by the Freeman School District. I currently live on the west side of the city since 1997 when I bought a house. I am, like I said, a Flint resident. I worked for the city of Flint from 97 through 2011 and then retired, and then they have brought me back. I've done a lot of other things. If you ever want to ask me, I'll sure just tell you the story. But just to let you know that I am an essential worker. I work for wastewater and water treatment plants, and I'm out there all the time. And I had the GCDC give me my shots back in January at Fenton's High School. So getting the shot, I didn't have any problems with it. And if I need to get a booster, I'll be one of the ones that'll get in there as quick as I can to try to stay healthy and provide for my family, as well as be safe for all the people around me.
Thank you, Michael. Now, one of the things that we do, Michael, in this webinar is when we put numbers out, people try them. So I would like to ask you to give us your number again that you'd like people to contact you, because that number seems to be a challenge for someone trying it right now. So what's the number we should call you, Michael?
Okay, well, the phone numbers I gave out are the phone numbers for Get the Lead Out in the chat. But my phone number is area code 810-766-7135. And you can follow that extension. That's to our DPW. And if you have a question or a problem, I want you to go to through the priority list that's there and hit the right number, and that'll get you the quickest information. But if you need to talk to me, my extension is 2602 when they ask for an extension. I'm going to give two other numbers that are really important. And the first number is for water. If you have any problem with water whatsoever, the number is 766-7202, area code 810-766-7202. That line is monitored 24 hours a day, 7 days a week. And those people will leave a message if it's outside of business hours, and they will get back to you as quick as they can. That's for if you see water shooting up in the street for a main break, or if you have problems with water pressure at your house or discoloration. Those people are the ones that can come and help you immediately. The second number is if you have water coming up in your basement through your drains, or or having problems with your drains running. that would be our sewer department. That number is 766-7079. Again, 766-7079. And those are our two most important numbers for anything water related for DPW. And I hope that everyone will use those. As I said on another telecast, the mayor loves getting your phone calls to hear about things, but it's a lot faster if you have a problem is to call one of those two numbers, because my people there will answer them and get back to you as quickly as they possibly can and help you as quickly as possibly can. With the mayor, that has to be sent in an email, has to be sent to me, then I got to send it to somebody else. I like eliminating the middlemen and get right to the people that are going to get the work done.
Well, we appreciate that, Michael, and that's why we're glad you're here today. So one more time, please, if you want to get your pipes replaced for free, you can call today. Otherwise, it may cost you to get that done. So thank you, Michael, and we'll look forward to you coming back and being with us again.
Well, I thank you very much for allowing me to be here.
Yes, sir. So we want to hear the last word. We want to hear from Dr. Reynolds. Dr. Reynolds, you were out last week, and I know there's so much to this story that could be told, but we want to just give you the last couple of minutes today to give us the great word of reflection.
Well, what I'd like to do is share an experience. I'm a Flint resident. I'm also a pediatrician, and I raised my family here. And as you recall, the things that Michael Brown is addressing now are related to this civil settlement case. And the case requires that in order to get maximum compensation, among your choices is having a high blood level, a record of that, and that, or that you volunteer for this so-called bone lead test, where they're using industrial equipment which was not made for human beings, and the manufacturer said did not use it. So as a parent, as a pediatrician, as a resident, what's the first thing I say? Well, if it's not made for human beings, why use it on human beings? So that's heaping insult upon injury, or injury upon injury, be it physical or psychic, when you're repeatedly being told you're not entitled to the same treatment as any other human is entitled to. And why would people sign up for this? So that they can get more money. And that's the problem with this settlement structure. Then there's a violation of what they call in court, I'm learning these things, due process. And due process is satisfied if a notice provides class members with the information necessary for them to make a decision whether to object to the settlement or not. Flint residents and whoever filed the claim was not supplied that information, that this equipment was not made for human beings. They did not tell you that the medical director of this venture was not authorized by New York University to do these things. We can't even find his Michigan license. So if you got your scan and you looked on it and you saw NYU, New York University, or you saw Harvard School of Public Health, they have nothing to do with this project. There are individuals who have some affiliation without the protection of human subjects for research. And you've heard me call this rogue research in the past. Then the question is this test actually valid? It is a research technique. And the few times where this equipment was authorized by the manufacturer, it was in a university research setting under the governance of an IRB. So what we're asking is that there be a hearing from a neutral expert who can comment on the use of this equipment, not Napoli and Associates hired medical physicist, but a neutral person, okay? And that would be a good step forward. And then strongly, we recommend dropping the bone scan from the settlement. And I'll wrap it up by saying, when we look at this settlement, it's like we're talking about, we have a pizza and it has so many slices. And then in this structure, some people get half a slice, other people get 2 slices with extra cheese, other people will get 2 slices with extra cheese and pepperoni. But what I'm saying to you is think about it before you jump for it.
Thank you so much, Dr. Reynolds, and you got us right to the time. We want to appreciate you and ask all of our listeners to please take heed and share information with your the other residents that you're working with. Continue to get community health workers. You can continue to get community health worker, continuing education units, and contact hours for social workers. Please follow those prompts. We want to thank you for listening and joining us today for the Flint Community Webinar on Coronavirus. Please like us on Facebook, subscribe to our YouTube channel, or contact us at info@healthyflintresearchcenter.org. That's info@hfrcc.org. Or give us a call at 810-835-2130. We certainly will look forward to you coming back and being with us next week. And we want you to know that we're here for you, and we look forward to your responses in our chats. Thank you so much, and we'll look forward to seeing you next week.